First of all, thank you for coming on. I found you on TikTok, so that's
Yes.
perfect. I found you on TikTok because I was trying to find information on mostly BV and yeast infections, but I just think that the whole topic of women's health is extremely taboo, but we're all dealing with it. And so, how do we make sure that more women are not only educated, but feel confident in the decisions they're making? Because I think a lot of times it's like, oh, just try this, and you really don't know, right? And
Mhm.
so having you answering a lot of our questions, but also too, I think we come from more of obviously the holistic health space. And sometimes, and we're even guilty of it, saying that traditionally trained practitioners of all sorts are either, you know, they're not paying attention to the most recent research or they're very anti trying other things. And one thing that I loved about you is you are a nurse practitioner, but you also seem to take a lot of different approaches. And to me, that is very comforting because I want someone who's going to think of every option and then make a good decision. So that's how I found you and DM'd
Mhm.
you, and here we are. So
Here
thank
we
you.
are.
Yeah. Or give us a little background of like your education and like how you got into women's health and all of that good stuff.
Yeah, so I went to nursing school and I had no intention on doing anything women's health, actually. I wanted to work in like the ICU or the ER or the operating room. And then for my nursing externship, I got placed on a mother baby unit, which is all postpartum. And I was like, internally, I was such a brat about it. I was like so upset. And luckily, like the Midwestern Nice was like, yes, thank you so much for my placement. Luckily, but then I had an amazing experience. So I was like, okay, let's look at women's health now. I worked as a nurse for a few years. I went back to grad school and I did a women's health nurse practitioner program. And everyone told me, don't do that. Like, do family practice because that way you have more options and you can always come back to women's health when you get some experience. And I was like, that sounds like my nightmare. So I did women's health. It actually ended up working out, luckily. But I worked, my first job was at an IVF center. Then I worked at Planned Parenthood. And now I've worked at a gynecology only clinic for quite some time. So kind of a span of everything. Like my youngest patient ever has been like 12. My oldest patient's been 99. So quite the span. I've been a nurse practitioner for almost 9 years now. So lots of different stuff, lots of good stories.
Yeah, no, that's incredible. One question, real quick. I didn't know that you had worked at a Planned Parenthood. Do you mind just talking a little bit about that experience?
Yeah, it was great. I still really miss a lot of the people that I worked with. Like all the medical assistants I work with were great. Like my nurse practitioners I worked with were really great. It was really one of the best learning experiences that I had too, because when I got out of working at an IVF center, like there was so much that I like hadn't done since grad school. And they had a really good orientation program. My preceptor was amazing. And, they're very much about like evidence-based practice. So like all of that I got up to speed on super duper fast. And then just working with patients where we're like, okay, we only have so many resources here. How do we make this work with your resources, with our limited resources? I had just moved to Chicago, so I moved to Chicago on a Saturday, and I started on Monday. And I had like been to Chicago like twice, and so I'm a little country bumpkin. I didn't know how to like get around like the bus, the train, and I had to go all the way downtown for orientation. I'm like, let's figure out how to use the red line. We can do this.
Wow, that just
Yeah, it was
dumping
really
you right in, right?
yeah. I was Other nurse practitioners would probably say the same thing where like it's very culturally different throughout the United States, like how people utilize nurse practitioners. Like I know people in the South who are like, I'm not allowed to do like almost anything besides like pap smears. They're like doctors might not just, because they're not used to it or their comfort level or whatever. They're not like comfortable with their nurse practitioners doing certain procedures, like even an IUD insertion. And I'm like, I did thousands and thousands and thousands. Like, so like being comfortable, like doing a ton of stuff was nice. And it's just so much patient education. So that was,
Mm.
I love patient education. And that's the whole reason I did a lot of social media stuff too, is just patient education. So that was huge.
Yeah. And so then now where you're at
Mhm.
today, you're doing everything from what we'll be talking a lot about today, like
Yeah.
BV, yeast infections, things like that, but also birth control, preventative health. I know you talk a lot about your social media. I've seen like cervical cancer,
Mhm.
pelvic floor health. What else am I missing? What other things are you constantly
Oh, yeah.
covering?
Lots of birth control, like you said, lots of like annual wellness type stuff, breast concerns, irregular bleeding, PCOS, endometriosis, fibroids, perimenopause, menopause, and pelvic organ prolapse. So a lot
Okay.
of different stuff.
And how much would you say, because one thing that I want to really work on is taking away the negative stigma and connotation with BV and yeast infections, because my hope today is that we'll hear about how normal they are. How
Yeah,
often do you see patients with those issues?
every day.
Every
Every
day.
single day,
Okay,
multiple
great.
times a day.
Yeah.
And even if maybe they don't even come in with that symptom, they might come in for an annual exam and I'm like, "Any changes to your discharge? Have you noticed
Mm,
anything? Because 'Cause I'm noticing some things." Or
mhm.
someone, like, comes in with irregular bleeding, I'm like, "Okay, hey, let's rule out yeast and bacteria because that can even cause irregular bleeding." So, multiple times a day, every day.
Interesting. And, I think that's so interesting because I think that when I first got BV, it got way worse than when I could have probably stopped it because I didn't know what it was at first.
Yep.
And so to hear those symptoms, we'll get into it in just a second, but I think that's super interesting because I think women don't really realize it's happening until in a really offensive symptom happens, like
Yes.
smell or
Yep.
like incredible discomfort. Because I think as women, we're often, especially when it comes to like women's health and our periods and things, we're used to things being a little painful or uncomfortable.
Mhm.
And so when those things first happen, we're not like, "Oh, we need to go to the doctor." It's like when
Yeah.
things get really bad. So would you say it's pretty normal for women to come in and you not that them not even realize there's an issue?
Oh, yeah, yeah, that don't
Wow,
even
okay.
realize it's there, or they're like same thing where they're like, "It's been going on." They're like, don't be mad at me, but it's been going on for like, I don't know, a month or two. I'm like, yeah, totally. Cause you just keep thinking it's gonna go away, or like you'll get your cycle and then it'll go away, or it ebbs and flows. So you're like, you get a good day and you're like, I'm fine now. And then it comes back. So, you know, that happens all the time.
Yeah.
Uh,
We're going to primarily talk about BV and yeast infections. Are there
mhm,
any other ones that we should bring into this? I don't want to get into sexually transmitted diseases because I feel like that's a
mhm.
different topic, but are there any other types of bacterial infections or anything like yeast that you see as common as those two?
What I think we'll probably start to see a little bit more commonly is mycoplasma and ureaplasma. I think we're talking about that a lot more. It's kind of in a gray area. Like it's not what you can conventionally think of as like, oh, just like BV and yeast, but it's not your conventional STI. It's
Mm,
not part of the recommended STI panel. It's not part of the recommended vaginitis panel. It's because it's in this weird area because we didn't have a good FDA approved test for mycoplasma until 2019.
no way.
Yeah, so
Wow.
people get really frustrated. They're like, "Why hasn't anyone tested for me for this before? Like, why did someone miss this?" It's like, well, because it wasn't even FDA approved till 2019, and then getting it out to people, and then knowing like when we should test people because the CDC still recommends like not testing people unless they're symptomatic. So there's still a lot we don't know about those, but that always falls into my category of if you're that person who you keep getting treated for BV and yeast and you feel like it just keeps coming back, or you're that person where they do the swab and they give you the medication, they say just go ahead and take it, it looks like BV or yeast, and it keeps coming back negative. Same thing with a urine cultures because it can cause urinary symptoms too. So if you're that person, keep getting a UTI, it keeps coming back negative. Antibiotics make it better for a little bit and then it comes back. Maybe ask about mycoplasma and ureaplasma testing because it is, and it's not that your provider is like not equipped or like not able to do it for you necessarily. Some places might not, low resource areas might not be able to test it, but not that they don't care about not testing for it. It's just that at this point, it's not recommended as part of your routine screening for STIs or routine vaginitis testing. But if you're that person that keeps coming back, that's one to ask about.
Wow. Okay, so let's first, since it's already at the topic, what
Mhm.
is I don't even know how to say it, ureaplasma and
Yeah, yeah.
micro or
Mycoplasma.
mycoplasma? What
Mhm,
are
yeah.
they? Because I've heard those names
Mhm.
in passing, but I have no idea what they are.
Yeah, so they're similar to BV and yeast in the fact that they're bacteria that can live in your urogenital flora and cause you no problems whatsoever when they're in small amounts. But when they overgrow, they can cause symptoms like a UTI, urinary frequency, burning, incomplete emptying, things like that. But they can also cause a lot of vaginal symptoms, even just like pelvic pain, irregular bleeding, discharge, all of that. The tough part is there's not a really good test for men. So if you have male partners, like getting them tested is going to be, I wouldn't say nigh impossible, but almost. So that's where it's really on a female partner to say like, okay, if I'm having recurrent symptoms, let me ask about this testing, especially again, like I wouldn't say you have to do it like as a part of your screening, because those tests might also be expensive, especially if you're in a low resource area. And that's another thing. We are trying to be judicious with people's insurance. So that's the other thing is like, let's rule out the easy stuff first. Like if this is your first time ever having a vaginal discharge issue, let's rule out yeast and bacteria. Great.
Right.
You've never been tested for STIs? Sure, let's do that. And then if everything's normal, then maybe let's test for mycoplasma and ureaplasma.
We have a lot of women who listen to our podcast who are having chronic yeast infections, having chronic BV. So they're probably listening to this saying, oh, like maybe this, I need to rule this out. Are there any indications other than BV and yeast won't go away? Like, are there different discharge colors? Is there, you said not fully emptying or something? I
Yeah,
have
yeah,
never,
the
what is
feeling
that?
like you yeah, the feeling like you can't empty your bladder all the way, like you go to the bathroom, you stop, and you're like 5 minutes later, you're like, "I gotta go again."
Ooh,
But then you
interesting.
actually go again?
Yeah, and you just like it's like you can only release like a small amount of urine at a time, or if you're that person, like every time after intercourse, you feel like you get a UTI, you're like, "I thought I like cleared it up and like I was being really careful," and like then they send out the urine culture and it's negative, but you've already started the antibiotic, you're feeling a little bit better,
That could be it.
but the symptoms keep coming back. The other thing that like pelvic pain can be another one where I'm like, okay, like if you say like, no, I've never had pelvic pain before, like all of the other testing comes back negative, or like pain with intercourse is another one. The big red flag for me is when someone says, yeah, I'm coming in because my doctor keeps, or my healthcare provider, whoever it is, keeps refilling my metronidazole or my fluconazole, my medication for my BV or my yeast, and it just keeps coming back. I'm like, we got to stop refilling that without an exam.
Right.
I had a patient one time who had gotten refills almost monthly for yeast medication for a year
Mm.
without an exam. Because her healthcare provider was like trying to do her a solid and be like, yeah, if you know it's yeast, here's your medication. She had BV the whole time.
Wow. I honestly
And
think that happened to me.
yeah,
Not a
happens all
year,
the
thank
time.
God, but
Yeah.
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 Yeah. And so, okay, so with the mycoplasma and the urea plasma, what are the treatments? Is it a different medication?
Yep.
Okay.
So
Got
that's
it.
the tough part is when people are like, well, won't the BV medication just take care of it? Won't the yeast medication just take care of it? No, it's doxycycline. That's the CDC recommended treatment is doxycycline for ureaplasma. But then if it's mycoplasma or both of them together, because why would it be simple? Sometimes they can come together and it makes it way harder. Sometimes because there's multiple, the way the CDC does their recommendations for treatment, their primary treatments and secondary treatments. So let's say you had like an allergy to the primary treatment. There's a secondary option, or you failed the primary treatment. You did the doxycycline, it didn't work. Here's a secondary option. So azithromycin can be in there too. We wouldn't have given anybody that for BV. And then sometimes we paired doxycycline plus azithromycin or doxycycline plus moxifloxacin, which is so hard to get and really expensive. It's like, it can be a mess.
I just still can't get over the fact that it's only been since 2019 that they've had tests for this.
Yeah. And what's interesting is if you've never heard of PID, it's pelvic inflammatory disease. Typically, like it's not something anybody would miss. Everyone's always scared that they've missed it and somehow they have it like raging in their pelvis and you didn't. PID is typically when you have really, really intense pelvic pain that comes along with like fever, chills, nausea, vomiting, like signs of an infection. And typically it is related to an STI. But about 10% of people who go to the emergency room with PID don't have an STI at all. So what we think now is it was probably mycoplasma or ureaplasma.
Wow.
So
Oh my
Right.
gosh.
yeah, which is crazy. So now that we have a test for it, we can do better treatment for PID. But and that being said, like not everybody who has mycoplasma or ureaplasma gets PID. It's not a very common issue, but that it could have been like hanging around this long and just we didn't have a good test for it.
Well, how are you contracting those two that's different from, say, contracting something like BV? Like, what's the difference in how you get those two?
Yeah.
Or
Good
either?
question. Yeah. So BV can happen with or without sexual intercourse, a myriad of environmental factors that can happen with that. And sometimes it can be related to intercourse, many factors there. Same thing with yeast. You could get that without ever having sex. Typically with mycoplasma and ureaplasma, they do kind of fall into potentially that sexually transmitted category because men can carry them too.
Oh.
But it's not a reportable infection. So that's where like I try and reassure patients. I'm like, don't think of this like an STI where you're like, oh my gosh, I've never had an STI. Now I feel so dirty. And like, that's what everyone says. I feel so gross. I feel so dirty. Like I have an STI. I'm like, you wouldn't be mad at yourself if you got yeast or BV from your partner. Like this happens. This could have lived in your vaginal flora unbeknownst to you for months and years, but it could have been exacerbated by intercourse, or your partner could also be carrying it, and that's why it flared up.
Sure.
So, and there is a lot of like question marks still about like transmission for a lot of things of like, why could you have intercourse with one partner and never get BV ever? And then another partner, you're like, I'm allergic to them. I get BV every time.
Mm-hmm.
Sometimes that can be products and other like environmental factors, but there's still a lot of stuff we don't know. Where like technically men could house like yeast or bacteria like in their genitalia, but like how much of it do they need to house or carry to make a problem for you? There's still a lot. Like we're just kind of figuring out like, what the heck does your gut microbiome do? What do we do about that? Vaginal microbiome? Yeah, like we're way behind.
Yeah.
And that goes alongside the complaint from, let's say, every woman that we're just behind in studies and there's not enough of us compared to men. Like, obviously it gets frustrating because you're like, what the heck? You know, it's unbelievable to me. Like, it's still crazy that we're just like, oh, we don't know everything. It's defeating.
Yeah. And even like the coverage of like healthcare for women, like the fight that like I posted about the fact that like you can get Viagra for like 5 cents.
Mm-hmm.
And I was trying to get a medication, any medication, covered for a patient for like hypoarousal sexual disorder. Hours on the phone with insurance, prior authorizations, peer-to-peers, nothing,
Wow.
zilch, nada enchilada, nothing. And it's not that way for everybody's insurance, but like if she was a man, she could have paid cash for Viagra and it would have cost her like, I don't know, like $1.
Right.
It's crazy.
Yeah.
No, and it's just not talked about, right? Like these conversations, I don't see them anywhere at least. And I've tried to find a lot of different podcasts, but one thing that I've seen a lot, especially on YouTube, which is interesting, is there's a lot of OBGYNs that are very anti boric acid that we'll get into and anti probiotics and all of these things. And when you watch them, then you start to feel helpless because you're like, so are there no answers? Is there nothing we can do? And then also, when you know that there's a lack of studies, then it kind of reaffirms that feeling of, okay, there isn't anything. And so I think one thing to start off with that would be helpful is what is the difference between BV and yeast? Because I think they're interchangeable a lot and they get misdiagnosed a lot. So what are they in like symptoms, but also like clinical definition?
Yeah, so BV, good question. So BV, bacterial vaginosis, Gardnerella, it goes by many names, is bacteria. And so it's going to require an antibiotic for treatment. And it typically presents as a fishy odor, a thin discharge, white to gray. If we looked inside the vagina, we say it looks like spilled milk because there's all this like white thin discharge and it kind of adheres to the vaginal walls. Like when we take a swab, we can kind of like swab it away and it kind of is adherent. The thing that a patient might notice is that they can have more of an odor. It can be more of that thing of the way I kind of tell people is like you go to like pull down your pants to go to the bathroom and you're like, oh my gosh. Yep, like that. Or after sex, it gets worse. And you can have a lot of discharge. I have patients come in all the time. They're like, I feel like I need to wear a liner because there's so much of it. Yeah. That's really common. It can also present itself just as pain and bleeding with intercourse because it creates so much inflammation that things just feel really uncomfortable and you can have some bleeding along with that. Where yeast is fungal. So if we look under the microscope at yeast, we call it hyphae and buds. So it looks like a little tree branch with like all these little buds on it because it's like budding. It's like very cool to look at. Not great for the patient, great for me. But it's fungal in nature, so we'll use an antifungal treatment. And then it typically, like your textbook way it presents is cottage cheese like discharge. So that can be like lots of watery with cottage cheese like discharge. It causes a lot of inflammation. The way I describe it is like the vaginal wall should be kind of bubblegum pink. When someone's got a really bad yeast infection, they are fire engine red. It creates a lot of inflammation. So that can also cause discomfort and bleeding with intercourse, where people are like, afterwards, I felt swollen, like on the inside. I felt so uncomfortable, that type of thing. Also, a lot of itching. And some people, maybe they'll have like a little bit of discharge, but they're like, everything else, like, I don't feel really uncomfortable. I just itch a lot on the outside too, because yeast can be external as well. It can live on the vulva. It can actually live anywhere where skin touches skin, anywhere it's warm, wet, and dark. You can get a yeast infection in your armpits, under your breast tissue, in your groin. You think of like male jock itch. Same.
Got it. Okay. And why do they happen often together?
Yep. So bacteria and fungus both like to live where it's warm, wet, and dark. So your vagina is a perfect place. So that's whenever someone's like, no, I think I'm doing everything right. It's like sometimes we're just set up for failure. I like to joke with patients. I'm like, I appreciate that the vast majority of my reproductive system is on the inside, where it's like warm and cozy and safe. It also makes it very mysterious and also like a perfect breeding ground for bacteria.
Yeah. No, that's actually a good way to think about it. I've never thought about it like that.
Yeah,
What
cozy,
about
safe, mysterious.
as far as, because so we got a lot of questions that were DM'd to us, and then I put like a little question box up, and then I also had some friends reach out and ask questions.
Yes.
And one of my friends actually texted me yesterday because I had told her that you were coming on, and she said that her discharge is yellow, which doesn't fall under the typical BV or yeast when she Googles it.
Right.
But she hasn't tested positive for an STD. So she's wondering, should I go back for BV and yeast? Or so I guess that question made me think, okay, what are the different colors mean? And are they like, can you have a yeast infection if you don't have the white thick discharge?
Yeah, that's a good question. Yeah, because I'm sure Google told her, like, you have chlamydia, obviously. And she's like, I'm going to go murder my partner. Like, great.
She texted me yesterday, actually, and she said the way it started was she goes, I haven't had sex in X amount of months. How the heck do I have chlamydia? And I literally was like, can you give me more information? And
Elaborate.
I also am going to tell you that I don't know the answer, but I can ask people.
Right.
So
Yeah.
that's literally how it started.
Yeah, so lots of different colors are normal. What often gets confused for an infection is ovulation. So patients come in all the time. They're like, it was so weird. Like I had all this discharge and it was like whitish to yellowish, and there was just so much of it. I'm like, was it almost like egg whites? And did it last for like 4 or 5 days and then it went away? Like, yeah, that was it. Like I feel silly coming in because all my symptoms are gone, and I'm gonna get my period next week. So like, I didn't want to miss my appointment. I'm like, did you ovulated? Which that can happen. Like if it smells more like a body odor, like musky type smell, or no smell, and it's just like you wipe and you're like, what is all this stuff coming out of me? And you are mid-cycle, if you know when your cycles are, if you're not on a birth control that stops your cycle, if you're mid-cycle, you got your period like a week and a half ago, 2 weeks ago, you're like, okay, I'm ovulating. It's okay. Take a deep breath. It's all good. It's not going to come with any other symptoms, itching, pain, odor, anything like that. Yellow to greenish discharge sometimes can happen with yeast, where people are like, there was some like that, like cottage cheese like stuff, but it's like almost green. It can be like this grayish, greenish, yellowish. And sometimes just with all that inflammation, it can create more of that yellowish discharge. If anyone is near perimenopause, menopause timeframe, and they're getting this thin yellow discharge, that's telling me there's probably not enough estrogen in the vagina, because it's basically all these like sloughing off of dead skin cells and inflammation. And when you go in and you look with the speculum, there's this thin little yellow discharge and the walls are red and grumpy. So that if someone's perimenopause, menopausal timeframe, like go in, get your swab, make sure everything's kosher, but then also talk about vaginal estrogen, because that might be part of the problem. But then if someone is just getting like a lot of discharge that's thin, white to gray to yellow, and there's a lot of it, maybe BV. But the watery plus cottage cheese-like can happen with yeast too. It can feel like it's everything all at once with yeast sometimes. And sometimes they can come together, which is so frustrating, but it can happen.
Yeah. Okay, I'm like sitting here, I'm like, this is what we should have been taught in middle
Yeah. Oh
school
my gosh, yeah.
health class, right?
I know.
Like
I know. It's
life
crazy.
would have been so much easier if you were given that knowledge instead of having to Google and guess and panic and search, because I
Right.
feel like, and because we're still not at the point, I don't think, maybe certain friend groups, but I think the majority of women would probably say that that's not what they're talking about over like a glass of wine with their friends.
Right, right. Or like you bring it up in hopes that someone else has experienced the same thing. And then everyone's like, oh, yeah, 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 yeah. Like 17 times. Or I'd see the same thing with cervical biopsies. Whenever someone's like, I got my first abnormal pap smear, I'm like, start talking to your friends about it. Most people have had an abnormal pap. It's going to be fine. Don't go down a Reddit rabbit hole. We love Reddit for many fun things. It's just not medical advice, probably.
Right.
Well,
Probably so.
yeah, I'm actually so grateful that I do know what ovulation is and how it looks,
Yeah.
because I'm like, I think I'd be freaking out often if I was, so I'm sure every time someone comes in and you're like, you're just ovulating, you're like, why do women not know about this?
Yeah.
Isn't it? Yeah, it's crazy.
Yeah. And like, I don't know about you guys. I appreciate the amount of like health education I got. It's not like I got zero, but
Yeah.
we had the like, when you're like 10, you talk about like getting your period and this is what a pad is. Here's a tampon, but we're not going to tell you how to insert it. So you're going to have that traumatic experience all by yourself. So figure that one out.
Exactly.
And then, yeah, I was like, I'm not 12. So like I had like dial up internet. It's not like I'm going to like Google how to put in a tampon. Like, are you kidding me? So yeah, it wasn't great. And then we talk about it like once and then we never talked about it again.
Yeah.
Yeah. Crazy.
That's like what I think is the problem, is that it's just taught so early in your life. And then other things happen along the years and you're like, everything seems just new and not talked about. And again, taboo. And like, that's why Jill and I wanted to have this conversation, is like, we're trying to make these conversations not taboo, because obviously every woman deals with these things. It's crazy.
With BV and yeast, it sounds like they are reoccurring more than they're just a one-time thing. How do you go about BV and yeast when you're frequently getting them?
So we count it as recurrent or chronic when someone's had it 4 times in 12 months, which sounds like a lot. You're like, do I really have to like seriously wait that long? Yes, because BV, especially when you get it once, you have a 40% chance of it recurring within that year. Some of that has to do with the bacteria. It's like a biofilm around the bacteria that can be hard to penetrate. I had a patient one time, she's like, I found this medication. It's from Australia and it's like supposed to attack the biofilm. I'm like, that is so cool. We don't live there. Are you going to Australia? I don't know. So that's the tough part, is that might be one of the reasons why. The second piece is there are so many environmental factors, things that we can do that can make it easier for the BV and yeast to be reoccurrent. So my big thing is like, okay, the first time we get it, let's talk about all the things that could have led up to this event and let's fix all the things so you don't get it again. So that's the first thing. It's like, okay, let's try and prevent you from getting it 4 times in a row. Then if you do get it 4 times in a year, number one, I got to remember that the CDC has secondary treatments. If you just took metronidazole by mouth 4 times in a row, maybe we need to try something else. And that's a tough part too. Is another thing we don't know is like, why do some people's bodies work better with metronidazole by mouth versus like a vaginal gel versus clindamycin? Like, we don't know, but you have those other options. So that's one thing you can always ask your provider is like, I did the same treatment 4 times in a row or 2 times in a row and it came right back. Okay, so we try a different treatment option. Or let's say you've tried multiple things. Then we talk about chronic treatment, which for BV would be the gel form, like twice a week for 3 months. So that's why I don't use it lightly. I always go through my list of like, have you changed all these things? Have you done all these things? Do you think you can adhere to a chronic treatment? Because that's a big ask for somebody. And the same thing for yeast. Did we check all the things? Did we change all the things we need to? And then it would be fluconazole once a week for 3 months. And there might be some other, other options for chronic treatment. There are some newer medications, which are nice. There's some newer ones for yeast and BV, But the newer ones are so terribly expensive because they are very convenient. They're like one-time dose options. And a lot of providers have kind of given up on those because they never get covered.
Is one of those called like Nuvella or something like
Yeah,
that?
Nuvessa. Yeah, yeah.
Nuvessa. So when I first got BV, they were like, listen, they like brought some samples, so you don't
Yeah.
even have to pay for it.
Yep.
And it worked. And so I was like, oh my gosh, this is so amazing. And so I went on like GoodRx or something because I was like, oh, like, especially because I was in it for a little while. I was in this like self-treat mode because I just felt
Yeah.
like no one was giving me answers.
Mhm.
And it was $300. I was like, well, that's not going to work for me.
Right. With a coupon, it's $300. It's crazy. There's another one called Solo Sec that's like granules. You like put in, you get to feel like, like your grandma. It's like little granules you put in like applesauce or pudding or yogurt. And then, I've had it work for patients, but it's just so incredibly expensive, hundreds and hundreds of dollars.
Wow. And that's so unfortunate because the last thing you want to do is not be able to take the medication that works the best because it's so expensive.
So expensive.
And if
Yeah.
you need the medication 4 times in a year, then, you're out $1,500, which is
Yes.
actually insane.
Right. Right. And that's why I'm like, it sounds a little silly. I'm big on like, what can we do on a budget? And that's why I'm really diligent about like, we have to go through the list and we have to do the boring stuff first. Because what if you're that person who is using douching products or vaginal cleansers, which is known to make it easier to get BV, like per CDC guidelines, it's on the website, for now at least. But if you're doing all the wrong things and like some of them are not fun to switch, I get it. And I've had patients who are like, well, I'm going to still keep doing that. You can't take that away from me. I'm like, well, then I'll see you in a month.
Right.
Sorry.
Wow.
Like,
Yeah.
and so it's stuff and I'm like, it's a big ask. It's a long list, but then we're going to keep coming back and let's just save your money. Cause like changing your underwear, changing your soap, not doing some things, like even just like not paying for certain things will save you money in the long run.
Right. And we're going to get to those in just a second. Before we do, let's talk about what to do to almost strengthen your vaginal health. So you've taken the medication. What are the things we need to be doing to prevent BV and yeast from coming back? And I'm talking everything, but from like what we're eating to boric acid type stuff, like give us all the things.
Yeah. So the first thing is like finish your medication. Before you even get to like, what do I do next? Finish your medication. If they said, do the metronidazole for 7 days, for 5 nights, for whatever, you got to finish it out because it is that thing of like, it started to feel a little bit better. And then I stopped and it came right back. Well, yes, of course. So finish your medication. Even if you start to feel better, you're never wrong to finish your medication out. Then after that, if you're that person who gets a yeast infection every time after you take an antibiotic, your healthcare provider you let them know, hey, every time I take the metronidazole, I get a yeast infection. Okay, because that metronidazole, we killed off all the good guys. It's hard for the bad guy. It's easy for bad guys to come in and be a problem. So they can prescribe you fluconazole. You can wait and see. They could just prescribe it. It could wait at your pharmacy for you just in case. The next things would be what we're eating, what we're doing. So I've seen the same thing where like providers online are like, boric acid's stupid. Probiotics are stupid. I'm like, well, it's not going to hurt anything. The big thing with boric acid, I like boric acid. I've actually worked with PhD Feminine Health. I had recommended their stuff for years before I ever worked with them, but I have worked with them. So boric acid, I think, is a great option as long as it's not hurting you. I've had a few patients who said, you know what? I inserted it. It was really uncomfortable. Or I inserted it and then I was spotting. Every time I use it, I have bleeding. Okay, then we're stopping it. It's not for everyone. But there have been studies shown that when someone is really, really struggling with BV treatment, to get it to stay away, you do your metronidazole and you follow it up with boric acid. And I do understand where some OBGYNs are like, no, like if you're just struggling with vaginal odor, then like, it shouldn't just be used for that. I think part of that is just like getting rid of the stigma of like, yes, your genitals have an odor. So if you have like a normal genital odor, it's fine. You don't need boric acid for that.
Mm-hmm.
Right. But the other thing is probiotics are great. I just always tell people like, you don't have to break the bank to utilize a probiotic. It's fine to like buy something that's like middle of the road price wise, and you can change up the brand there's no perfect brand. If you change up your brand every few months, you're getting different strains of bacteria. That's great. But let's say you don't even have the money to buy a probiotic. All you've got is your grocery budget. Great. You can use, let's go really hard on the cruciferous vegetables, cauliflower, broccoli, Brussels sprouts, cabbage. Gas producing vegetables, less gas producing when they're cooked, but good for you. It's going to feed all that good bacteria in your gut. You need lots of lactobacilli in the vagina. That's what keeps your pH balance normal. So if those things can fit in your budget, broccoli, cauliflower, pretty cheap, not too bad, cheaper than a probiotic if you can't afford it. Same thing with boring fermented foods. That's the thing. It's like plain yogurt, plain kefir, kimchi, kombucha, whatever. Like keep it super boring. And then, because if you're getting like the flavored yogurt, which like sure delicious, but like all the extra sugar in there like kill all the good guys, so it's not even worth it. So you got to go boring, and boring is cheaper. That's the good thing. Is like boring is cheaper. So if you like I can't afford a probiotic, we get it in this economy. Understand, but cruciferous vegetables, fermented foods. If you can do a probiotic, that would be great, but you don't have to break the bank. Probably just don't go with the gummies that are like on the shelf, like at room temperature. You're probably not getting a lot there. So it's probably not even worth your money.
I've actually two things. One, with eating fermented foods and cruciferous vegetables, our community likes specific. So is that once a day, twice a day, 3 times, every single meal? Like what's the frequency that's going to help the most?
Yeah. If we could do like, if you could get like 2 servings of cruciferous vegetables, that'd be great. Cause like, especially if you're like subbing those out for like, let's say you're just like kind of like a carrots and celery girl, like, okay, well, we need a little bit more variety.
Right.
So that would be great. So then if you could swap those out, because like we need, a certain amount of servings of vegetables per day. So if you could swap those out, what I would say probably though is taper. Start with just 1 serving a day. Because if you've got a really sensitive stomach, my fear, and I'm a little bit more cautious than I think some providers are with a lot of things. And one of those is just like, I never want someone to start a new intervention and have such a bad experience, they're never going to do it again. So if you are like, you're starting a baseline, you're like, man, my vegetables are potatoes and corn. Okay, well, that's fine. We're going to add in like 1 serving of a cruciferous vegetable a day. Can your stomach tolerate it? Great, wonderful. Like let's bump it up to 2. You don't like any fermented foods. You hate kombucha and kimchi and kefir. You can do, maybe we're adding some plain yogurt, and then you add in your own fruit, you add in your own granola, like all of that's fabulous, amazing. Like let's make it palatable to you so you'll tolerate it. But if you could do like 2 servings of a cruciferous vegetable, or if you don't like them, then focusing more on the fermented foods and doing like 2 servings, you could do some kimchi or some sauerkraut and some yogurt. Like that's easy peasy to add into your daily regimen, yogurt in the morning, some sauerkraut at night, easy peasy.
Yeah, absolutely. There are a few housekeeping questions I have that we can just run through really quickly. As far as underwear goes, I know the answer to this, but I'm going to have you say it anyway.
Yes, totally.
When it comes to underwear, can we be wearing thongs?
I'm sorry. I'm going to break your heart. I'm so sorry. I am so anti-thong because also like I'm not like in my clubbing era. I am a 30-something mom with gray hair. Like it's covered up now, but like, so I don't care about visible panty lines, and probably no one else does. Like, okay, I always tell people you can save your one thong for that special dress, for that special occasion that you really don't want a visible panty line. Congratulations. Great. Wonderful. But you're going to wear it so sparingly to the event and then right off, because thongs are a little tightrope that lets all the bacteria from your backside crawl up to your front side. So if you're getting recurrent UTIs, the thongs got to go, because E. coli is the most common cause of UTIs. Greater than 90% of UTIs are caused by E. coli. E. coli is in your stool. So basically that thong is letting particles of your stool crawl right up. And the same thing with BV is like stool matter can get into the vaginal canal. Boom, that throws off your pH balance. So goodbye to thongs. I know you love them. I'm sorry. And then there's always somebody in the comments who says, I've worn a thong every day of my adult life and I've never had BV or yeast. Well, congratulations. Mm-hmm. Congratulations. We are happy for you. Live your best life. But if you're struggling, get rid of them.
Right. Okay. Second, and I've seen this on TikToks before, the underwear that we do have, if you have BV, is it okay to wear it once BV's gone, or is it like living in your underwear?
Oh, yeah. Yeah. There's no evidence that it can really live on fabrics for a long time or anything. So if you're washing your underwear, like you don't have to throw them out every time you get BV. Like that would be a budgetary problem.
It
so
really would.
I would tell people like, Go get the 10-pack at Target, Costco, whatever, and call it a day.
Right. Should we be using 100% cotton underwear, or does the material not matter?
I typically recommend 100% cotton. They're pretty easy. They're pretty cheap. Now sometimes you'll find like 95% cotton because the elastic waistband is elastic, that type of thing. That's fine. I have some people who are like, no, like what about like modal, which is typically like in the MeUndies, which there's some evidence that like that is just as breathable. I think like the very, very like high end silk is supposed to be really breathable, but who exactly is buying that? Like not most of us. And then there's like some newer underwear that are like, I've seen a lot of advertisements for newer ones that are like supposed to be more breathable, supposed to be A, B, C, and D. I'm definitely not discounting those. My biggest thing is like, what's going to work the best for the most amount of people? Probably boring cotton. That is accessible. It is inexpensive, and it probably is going to work. If you're dropping like crazy amounts of coin on like expensive silk underwear and like your BV still keeps coming back, that's worse.
Yeah. Moving through more panty liners, should we be wearing them? A lot of women that struggle with these issues, they have a lot of extra discharge, and so they want to wear them. What are your thoughts on panty liners?
Really try not to. Really try not to. If you're someone who's like struggling with incontinence and you have to, then I would caution people, if it's an incontinence issue, stay away from, and even if you're using like incontinence pads like to deal with BV and yeast, try and stay away from the incontinence products if you can, or be very diligent about it, because a lot of times they have odor reducing agents, fragrances and things like that. You can get a contact dermatitis, basically like a diaper rash, from your pad or your liner, because it can have lots of ingredients that are problematic for you and your body. So try and stay away from the panty liners as much as you can. I understand if you have a lot of discharge, it can be uncomfortable. So I always tell people, like, I would rather you bring an extra set of underwear to work to change halfway through the day than wear a panty liner, or wear them like such a small amount of time, because when you put that liner on, you're getting rid of any breathability that there was. And then if you're like many of us, you just got like the cheapest one that was there, the one that was on sale, the store brand, whatever, and you didn't check if it has no chlorine, no bleach, no dye, no fragrance. Like it can, I've had patients who come in and it's basically like a diaper rash. Or there's one that's had patients, she's like, I feel like I put a peppermint on my vulva. It's like, oh yeah, that does not feel good. You got the discharge, you got vulva problems now. It's a rough time.
Ouch. That's not fun.
Yeah. Not a good time.
What about going commando? You're a gym girly, you're wearing the leggings or the biker shorts, and you don't want to wear the big bulky cotton underwear. What's worse, a thong or commando?
Thongs. Yeah.
Okay.
I have patients like, oh, is it okay if I go commando? Yeah, I'm fine with that. The big thing is like, if it's a gym thing, you're like, I will not wear joggers or sweats to work out. I understand. Like, I'm not like a cyclist person. I don't even know what it would be like to do a cycling class with joggers. Like maybe not great. I don't know. So, but if you're like, I'm never going to wear running shorts, I'm never going to wear joggers or sweatpants. Yes, for leggings and bike shorts, only for exercise. And now if you're that person, you're like, I wear leggings every day of my life, I've never had vaginal issues, congratulations, amazing. But if you're that person who's struggling and you wear leggings all the time, you wear bike shorts all the time, and you do what we all do, you work out, and then you're like, let me go run like 17 to 24 errands really quick, and then I'll go change. It's warm, it's wet, it's dark. So you can wear them when you work out, strip them off right away, throw on your sweatpants, and call it a day.
Okay. Do we have to be worried? I don't know if you're into this, but I'm on the side of TikTok where girls are talking about how certain brands of leggings and clothing these days have chemicals that could potentially disrupt us, like Lululemon and places like that, not to call a brand out, but do we need to be like, okay, like someone with reoccurring yeast infections or BV, more cognizant of what brand they're choosing?
Yeah. And this is where this is like a really hard sell, because again, like I understand, like we also live in a very aesthetic world. Yes. And like you want to go to the gym, and you also like, you want to look cute. And I think it comes with time, and potentially like, I also like, so I used to be in the military, and we didn't even used to have like athletic material, like PT uniforms. It was like a huge cotton gray shirt, the biggest like slicky pants that you could ever find, I am used to looking like not aesthetically pleasing during exercise. So I don't
Right.
care. I will wear sweatpants to the gym. I will wear joggers. I'll wear a big baggy sweater. Don't look at me. Look away. There's nothing to see here. That is how I exercise. But I understand that other people don't feel that way. But this is my hard sell. It's easy to not have to worry about it if you just don't engage with it at all. Like if you're that person who's struggling with recurrent issues and you're lifting at the gym, there's no problem with lifting in sweatpants. Like there is no problem in lifting in joggers. Now, I understand definitely like if cycling is your jam, that can be a little bit harder, but like try the light, loose, breathable jogging shorts. Give them a try. If it's so much chafing and it's terrible, then you never have to do it again, but give it a try. Right. So that's where I'd say is like you can not have to worry about it by just not engaging with it at all. And Lululemon's so expensive, guys, in this economy. You probably can't afford it.
Yeah.
Help yourself out.
Yeah.
What about lube? That was a common question we got is there a certain type of lube and condoms? I actually saw that one on your page, but are there safer versions? Should we be using them? Should we not?
Yeah, great question. So probably the no things to get rid of. Latex condoms can work for a lot of people, but you can develop a latex sensitivity over time with repeated exposure. So if you're like, oh, I keep getting irritated after intercourse and like swabs keep coming back negative, or like it hurts for a couple days and it gets better. If you're using latex condoms, then just switch to non-latex. It's just easier that way. Just go non-latex. If you're someone who's really sensitive in general, you have sensitive skin, just go with non-latex. It's just easier that way. And they're price comparable. It's not like you're going to pay an arm and a leg extra for that. Spermicide can be helpful for some people, especially if you're utilizing barrier methods like a diaphragm or cervical cap, but they can be really irritating to some people. So that's just something I would talk to with your healthcare provider. Like some condoms come with spermicide, but hopefully the condom's just not breaking in the first place, or you're using like multiple methods of contraception, so you shouldn't have to worry about it. But spermicide can be a little bit dicey for some people. Helpful for the birth control piece, potentially irritating. Lubricant. Lots of lubricant. You can never have too much. The most common reason that condoms break is due to lack of lubrication. So lots of lubricant right at the vaginal opening. So there's not that insertional pain. There's not that scrapey feeling. There's not those micro tears right after. And then you go to like wipe after sex and there's pink on the paper because micro tears, that type of thing. Lubricant. Nothing that's warming, cooling, tingling, flavors, fragrances, none of it. Like none of that can go near your vagina. If you're like, oh, but like we use like this like body oil, like massage oil, great, cool. Keep it like so far away from your vagina. Great. A couple brands that I recommend, I don't like partner with any of these brands. It's just like what patients have liked. Good Clean Love is a nice one, except it does have aloe. And I've had some patients who don't like aloe, or if you're allergic, obviously. Astroglide is really nice. They have a ultra sensitive formulation that is paraben free. They do have some fragrance stuff, so like obviously stay away from that. But that's like over the counter. Both of those, Target, Walgreens, CVS, very reachable. One I've never tried, but I know a lot of pelvic floor physical therapists love is Coco New. It uses coconut oil, so obviously some patients I was like, I just don't like the smell of coconut oil. Okay, well then don't do that. But last but not least, Astroglide. I have never had a patient complain about Astroglide. Never. And again, they pay me no money. I wish they did. But I've never had a patient complain about Astroglide. The only downside is you got to order it online.
Okay. Well, there you go. Those are perfect housekeeping questions. I think the last thing that I personally selfishly wanted to know was we've used Evie a lot. And the reason we use Evie, and we have been sponsored by them, so they have paid us money, but I pay for my tests personally. And the reason I like it is because when you get your tests back, they break down every type of good and bad bacteria you have. And for me, that feels very comforting because then I have some ideas as to what's good, what's bad. When you are doing testing, are you guys testing to that same degree? Like, are you able to see, 50% of the bacteria on the swab that came back is Gardnerella or it's good bacteria? Like, are you seeing that, or based off insurance and time and all those things, do you guys get less purview into exactly what's going on?
We'll get less. And there's probably two ways your provider can do it. If you're in a really low resource area, like what we would do like at Planned Parenthood for a lot of people, or if you're somewhere like maybe like a public health department, depending on your location, obviously, you're going to do microscopy. So that's where you take the swabs, you put them on a slide, and you put them under the microscope. And the benefit of that is that I can tell the patient right then and there, you have BV. I see it. I see the clue cells. And I put your swab on pH paper. I can tell your pH is elevated. Ta-da, you have BV. Or I can see the yeast. I can see the buds and hyphae right there. You have yeast. I can treat you right there, and I know that I'm treating you appropriately. Versus like, here's your medication. We'll get the results back in a couple of days. So typically the swab that your provider would be doing and sending out is going to test for yeast, and it might test for a couple different types and tell you if it's positive or negative. And then for BV, it's going to look at a couple different factors and give you a score of like 0 to 6. Like 0 to 2 is like negative, 2+ is positive. I have had patients who wanted more than that. Or I've had patients where like we just cannot figure out what's going on. Everything is negative. And I've done an aerobic and anaerobic culture. Sometimes that's something that your provider could do. I don't do it at baseline because most patients don't need it. But if we can't figure out what's going on, aerobic, anaerobic culture, is there some weird bacteria? So that's helpful for the weird ones where you're like, this isn't something that would come up on anything else. Like I've had patients too, like with weird like lesions where they're like, oh, I've always tested negative for herpes, but like I keep getting this spot that keeps getting like irritated. Aerobic, anaerobic culture, like MRSA, strep, like all kinds of crazy stuff. But when it comes to like figuring out like how much good bacteria you have, that's a tough one because there's not a good swab that's covered by insurance that's like available in lots of providers' offices. And then the tough part too is like someone could have not a lot of symptoms and have just a really unfortunate like vaginal pH, think of like patients in menopause. They're like, I feel fine. And I do their speculum exam and I'm like, how are you fine? How are you fine? There's so much inflammation. Like these walls are so grumpy. Like, how are you fine? So that's the hard part is like everyone feels so differently, like at their normal baseline of like of good and then not. And then what people are comfortable with. I've had patients who like have normal vaginal discharge and they're like, I hate it. I wish I had no discharge at all. I'm like, oh, no.
Sorry.
Right.
And I will say the thing that I really enjoyed about Evie and the reason I'm speaking about it now is because I'm someone that needs to know exactly what's going on
Yeah.
and I need to know how close I am to the finish line. And
Mm-hmm.
so for me with Evie, I've taken 2 tests so far and I've seen increased amounts
Yeah.
of good bacteria and decreased amounts of bad bacteria. And I know that there will always be some quote unquote bad because we just need like more good than there is bad. But I like to know like the trajectory that I'm going on.
Right.
And
Yeah.
my gynecologist was so great because she was like, oh, like, let me just look at these results. Like, I don't need to retest if you got tested last month. Like, if you have
Right.
50%, BV bacteria, I'm feeling really comfortable in guessing that that's what's going on still from a month ago. And for me, it was like, okay, I am paying for Evie, but I'm at least not paying again when I go to
Right.
my gynecologist. So I felt like that was really helpful. And I was so appreciative that she was willing to kind of work with that because at the end of the day, like whatever she tells me to do, I'm going to do. But it was great because I felt like, we were using multiple resources and being able
Yeah.
to create a plan to kind of tackle it. So I want to say that for all the girls and women at home that are dealing with it, because for me, if you
Yeah.
are that person because we will try some really funky things to try to get it to go away on our own when we feel like
Yeah.
our provider is not listening to us or is not helping us. And so Evie is a very safe route to go
Right.
if you
Yeah. That is safer
can
than the
afford it.
yogurt tampon. Yeah.
Right, exactly, because there are some
Yeah.
funky things out there. But I think that answers a lot, if not all of our questions that were asked. It was funny,
Well,
it's the same questions being asked over and over and over again. Jen, do you have anything to add?
I think the biggest there so obviously we're considered more like of a functional health podcast. I do a lot of gut work with clients and I'm a functional gut health practitioner. And so I always like questions that go through my mind is like how, why, root cause, how does Jill end up with chronic BV issues? How do I not? What's at the core of that? Is it stress? Is it diet? Is it what's going on in your gut? Can you kind of sum up a few things that can give people a little bit more clued into like, and obviously sexual intercourse and everything like that contribute to it. But when you see like an overarching theme, is there anything that you see it's like, oh, well, that person's gut flora was just not good to begin with, or that person just didn't have maybe as strong of a diet as they should? Do you see common themes often with your patients as to what, why are these issues occurring with them versus maybe someone, not someone else?
Yeah, yeah. I've had patients who, gosh, I've had patients in tears who are like, I'm just ready to like leave my partner because like this isn't fair to either of us. Like we can't like be intimate. Like, and I just don't know how this is going to work anymore. And it's terrible. Our patients are like, I'm embarrassed to go to work. I feel like people can smell me. Like just really bad situations where it's really chronic. And I will say this is, totally anecdotal, no like evidence behind this, but those patients absolutely benefited from improving their diet and decreasing their stress. So a lot of them would report to me, they're like, this is what I did. Because, one thing with yeast, recurrent yeast, is that it can be the canary in the coal mine for insulin resistance. When people keep getting yeast infections, whether it's vaginal, vulva, groin, under the breast, under the armpit, if you're an uncontrolled diabetic, just welcome yeast into your life. Like that, it is going to live there. So we have to get that under control. So if someone has recurrent yeast, I'm like, let's check your hemoglobin A1C. Is that the reason why you can't get rid of this? And you're just going to keep coming back no matter how hard you try. So that is a big one. So I've had some patients who are like, this one patient was a perfect example. She was like, I eat it. Now she came back. She was happy camper now after being just in the depths of despair. But she was like, I really cut down my sugar a lot. I ate a lot of protein, a lot of vegetables, low glycemic fruits, and I like really limit my alcohol. It's like very dry red wine only, or like, low sugar stuff. And she's like, but I'm back because I have some symptoms because I had an anniversary dinner and I ate whatever I wanted. It was all worth it and I do it again. But I think a little something's going on. I'm like, perfect, wonderful, like great, like we can deal with that. But that can happen a lot where people are like, especially stress as well. Like if you're not sleeping and then, when you're underslept, you like from a clinical perspective, like you can't make as good of food choices. Like when you're underslept, people who are underslept make worse food choices. So those issues can definitely be there. Or if you're someone, let's say just unfortunately, I've had patients where they're like had surgery, had to be on antibiotics. Surgical site wasn't healing, had to be on another round of antibiotics. So there are things where like that was necessary. We needed your surgical site to heal. Like if that, we would have had bigger fish to fry than like a yeast infection if your surgical site didn't heal. So there are necessary evils that can set you up for more problems. If a partner gave you an STI and you had to be on weeks of doxycycline to clear it, that's the worst. But, and this doesn't apply to everybody, but what's important to remember is that also patients who come from a lower income are more likely to have BV. And there's some cultural aspects that I think are really important. I've had so many patients who are like, you're never going to convince me not to wash my vagina. You're never going to convince me it's dirty. I'm going to wash it. Like,
oh, interesting.
All right. So number one, like a lot of patients are told, and especially like in certain cultures, different areas of the world, different areas of the country, it's dirty, it's yucky, wash it, it's gross.
Right.
If you are CDC website, if you are using douching products, if you're using vaginal washes and cleansers, you're more likely to get BV. You're washing away all the good guys that would protect you against the bad guys. So that's a tough one too. If you're told that your genitals are yucky and dirty and wrong, and you're washing them all the time, it's going to be a problem. If you're told you have to smell really good, that's a whole side of TikTok and YouTube of how I smell good. And it's 75 different fragrance products.
Yep.
And then you're trying to get like cheap or fragranced menstrual products because you want to smell bad. And your partner's doing the same thing. They're using 75 different scents. It's going to throw you off. Yeah.
Right. Yeah. One question that I was just looking at on Instagram too, from one of our friends is when the yeast keeps coming back around your period and then it goes away. I want to make sure we cover that because I think that happens to a lot of people.
So it can be
what do you do about that?
Okay. Yeah, two things. If you're that person, you're like, man, it's like right before my period. I feel like I have a yeast infection. I'm so irritated. But then I get my period and it's gone.
Yep.
If it happens right before your period, it might not be yeast. It is because when you ovulate, your estrogen's high. You feel amazing. It's wonderful. But then that tanks and your progesterone soars because your body's like, hey, I'm here to support you during pregnancy or prepare for a period, whatever it is. But that massive amount of progesterone will cause vaginal dryness and irritation to the point where you feel like you have a yeast infection.
Interesting.
That's before your period. What about if it's after?
Yep. So if it's before your period, it might be the progesterone. Let's talk about like vaginal moisturizers. Like that's okay. Or like lubricant even, like those things are fine. If it's after your period, let's look at your menstrual products. If you're like, oh, I have it happen all the time. Patients say, oh, I feel like my period gives me a yeast infection. It's not your period. It's potentially the product. So are you using pads, tampons, panty liners that have chlorine, bleach, dye, fragrance? Or are you that person you're like, oh, like my period makes me feel so gross. I'm going to use 100 baby wipes all the time to feel more fresh. No, those things got to go.
How do you feel about menstrual cups?
Love them. Love cups, discs, underwear, all of it's good. As long as like with the underwear, I'm big on like reducing fragrance because about 5% of people develop a sensitivity to fragrance over time. So if you're getting recurrent issues, just get rid of the fragrance. It's not going to cost you anything. Just get rid of it. Make life easier. So if you do period underwear, just wash them in unscented soap. Cups and discs are great. The only thing with a cup is it uses suction. So some people struggle with that. If you're like, I tried a cup and it was like terrible, then try a disc, no suction.
Okay. So real quick, going back to the rising progesterone. Yeah. Okay. What do you do about that?
Some people will go through a season of life where that's more of a problem. Some people, it's more recurrent. It's a good thing. That's the crappy part. It's like, it's a really good thing. Just like being tired and constipated and bloated all before your period is like, hey, that's all that progesterone. Who's like, I'm here to support you during pregnancy. And like the way I had a professor describe it, she was like, this was from an evolutionary standpoint, this is your body saying, go to the hut at the edge of the village and like rest and eat and sleep. Except we don't have a hut at the end of the village anymore. Like you got to go to work. So like deuces. Right. So it's like vaginal moisturizers. Like if you're someone who likes coconut oil, if you're someone who like has found a lubricant that works for you, okay, just applying that on the inside so you feel more comfortable and your period's going to come.
Okay. Interesting. That's actually really, I'm glad you said that because I think maybe some people or maybe our friend is like, oh my God, here I am getting another yeast infection. But really you're like, okay, no, that's actually normal feelings and symptoms to have.
Yeah. If it always goes away, then yeah, you might be more reassured. If it was persistent after your period, then it's worth a visit.
Cool. This has been so helpful. I'm so excited for everyone to hear it because it's going to be great. And we have some good clips for social media as well. Yeah. So that's awesome. Yeah. Thank you again. And you have a really awesome Instagram. And so can you share and TikTok, can you share your social handles so people know where to find you?
Yeah. So I started everything as no awkward question because I like to think that there's no such thing as an awkward question. Patients come in all the time like, that's a really awkward, embarrassing question. There's no such thing. So don't worry. There's no such thing as an awkward question. I am on Instagram and Facebook, no awkward question. Same thing on TikTok. I have the tiniest little YouTube. It's mostly just like shorts and stuff. And then I also have a website. The website might be helpful if I'm trying to add more like printable and downloadable resources for patients that they could bring to their appointments. So there's one about vaginal health is like, here are the basic things. And so that way you can be like, okay, yeah, I did all those things. Maybe ask your provider about this stuff. And then same thing like for an annual exam, for birth control. So that way you kind of have, because people just come in, they're like, I don't even know what to ask. Or it's like, well, I read about this one thing on Reddit, so this hopefully is helpful, noawkwardquestion.com. So
incredible. We'll go follow. And
we'll put it all in the show notes for you guys to see it too.
Sounds good. Awesome. And thanks so much for having me. Hopefully this answers people's questions so then they can avoid some visits, avoid your copay, or just feel more empowered to know what questions to ask.
Yes. We love that.